Welcome to this overview about the Vermont Brain Injury State Annual Action Plan. This is brought to you by the Department of Disabilities, Aging, and Independent Living. We are asking the public and stakeholders to provide us with feedback on this plan that hopes to address and improve the system of supports and services for Vermonters who have experienced a brain injury, family members, caregivers, and providers of services. So we need an action plan because the data tells us the following. In 2010 to 2014, the traumatic brain injury hospitalizations and emergency department visits showed that the most common injury was due to falls. Over half were due to falls. So our plan would address how to prevent falls. The Brain Injury Association of Vermont estimates 9,000 Vermonters are living with a traumatic brain injury. And the Department of Health does a survey to middle school and high school students. 1 out of 5 youth had reported a concussion in the past year. The incarcerated population nationally shows a higher rate of a history of traumatic brain injury, 7 times more likely than the general public. The Department of Corrections is going to be looking at screening all of the incarcerated individuals in the state and determining what the percentage of the history of traumatic brain injury is. And of course, the other reason why we have to do this state plan is every brain injury is different and has unique needs in order to recover from the brain injury. Finally, we did a needs assessment, and it showed what Vermonters felt about their experience with brain injury services and supports. This included family members, providers of services, and of course individuals that had experienced a brain injury. So let's look at the 3 priorities. Education, early identification, and referral. That helps us with the levels of prevention for primary and secondary prevention. We want to do education to raise brain awareness so that we can prevent brain injury. And we want to make sure that once there are symptoms or you go to the healthcare provider, that you receive screening and diagnosis and referral for services and supports. Resource development and enhancements to current resources is a second priority in this action plan. And the third one is comprehensive array of services. So we are looking at services for those with acquired brain injury. By definition, those are individuals that have a brain injury after birth. It can be traumatic or non-traumatic. So examples of non-traumatic would be like a drug overdose or seizures that cause an internal force of the brain that can damage the brain, or something like a stroke. Traumatic, of course, is your blow or hit to the head or a jolt to your head or neck area. Early identification and referral. So our goal is that we want to improve the number of individuals that receive an early identification and diagnosis of a brain injury, and then they're timely referred to the services and supports that are going to best help them. So after 12 months, what we hope to see is that no matter where an individual enters the healthcare or the provider system where you can get screened and assessed, that it's quickly after the initial brain injury, and that professionals are skilled and have the abilities to do the diagnosis. We also want to make sure those professionals are able to refer to information for the patient or the person with the brain injury and the services. So the time between diagnosis and services will be shortened. One strategy we have for this is we're going to try to refer people to the Brain Injury Association of Vermont that has a helpline. It also has a website with lots of information. So we're going to connect hospitals and providers with the information about how to get their people that are coming in with brain injury to the central helpline. Resource development enhancements. So no matter where you are in the state of Vermont, we hope to ensure access to a comprehensive array of resources or things in order to help an individual, a provider, or a family member. So let's take an example of after 12 months, I'm an individual, and we know what the social, economic, and other supports are because they're advertised. So this might be something like maybe you need help with vocational rehabilitation, and so you know that in each of the areas across the state there is a location where you can get those kind of services to relearn skills for a new job. Or maybe you need some kind of social supports. Maybe you need to access help with food insecurity because you're not making as much for your family and yourself. So that would be another thing that's readily known and advertised to people so that they can access those services. We're going to fill the gaps over time because we know there are some. And professionals are going to know how to connect individuals to the information and resources that we talked about earlier. So they'll know who to refer to in their local community and also have the Brain Injury Association of Vermont as a central hub to send people to. So let's look at the comprehensive services, which is the third priority. So for this goal, we want to increase service coordination across the systems of care that address the whole person. So a person with a brain injury may have cognitive, social, emotional, physical, a variety of needs that need support. So in 12 months, we think that a good place to be is that there are care coordinators or case managers available, because it is hard to navigate the system of services and supports. We also think that peer groups and support groups or mentors are very valuable, so we hope that all regions have this widely available. People learn from one another who have similar experiences. And the Brain Injury Association of Vermont has been very helpful in trying to coordinate with facilitators and list when these support groups are meeting, and always looking for people that can be mentors or facilitators of support groups. And the third outcome we'd like to see, or the result of the 12-month action plan, is there are partnerships that exist across the state, or we can pull together a group of people to coordinate comprehensive services to support a whole person with a brain injury. So the Department of Disabilities, Aging, and Independent Living would like to coordinate with the community health teams as one way of building those partnerships for coordination of care across systems. So we are asking the public for their input and stakeholders. So the first thing you can do is to go to the DAIL or the Brain Injury of Vermont website and their social media platforms to read the full plan, which will be available later this year. But this is giving you an overview of what we're trying to do. And if you do know some stakeholders, we'd like to know who they are, because you know your community, you know your neighborhood, you know what's going on in your organization where you work at, and there are likely new people that we can connect with about the plan and how they're supporting the work of the plan. So the key questions we're asking everyone is, what is happening at your work, in your community or life that supports the plan, 1, 2, or all 3 goals? And what are exactly the actions that you're taking to do that? We'd like to know what those are. The second question is, do you know any resources, new places, new resources, new grant funding, new partners that we can connect with, and maybe they can help us with care coordination of the whole person, or maybe they can help us with education, or maybe they can help us with resource development. So what we're asking people to do is to send their input and feedback on this plan and ideas to ahs.dalebraininjuryplan@vermont.gov. Stay tuned to the website and we'll keep you updated. Thank you for your time and support. We look forward to hearing from you.